Are you looking for glute or core exercises that won't hurt your knees? Here are 8 for you to choose from. For those of you who don't know me, my name is Maryke. I'm one of the physiotherapists from sportsinjuryphysio.com, where you can get online physiotherapy assessment as well as treatment of any type of sports injuries, all done via video call. Have a look at the description of this video if you want a link to our website. Before we start, there are a few things you've got to keep in mind. So the first one is, you know that saying of no pain, no gain? Well, that's absolute nonsense. If any of these exercises causes actual pain anywhere in your body, or either while you're doing it or in the 24 hours after, you need to get them adapted because that's not correct. If it hurts your knees to get down to the floor, don't do it on the floor, do them on the bed. That's absolutely fine as well. Also, I'm giving you 8 exercises. The idea is not that you go and do all 8 in one session. I wanted to give you different things to pick from. So you may notice that actually there's a couple of exercises that work the same muscle group. And the reason for that is they are done in slightly different positions or performed in different positions. And some people just find that more comfortable. So choose what works best for you. And lastly, these exercises are usually safe for most people. But if you have a serious knee injury or you have a chronic health condition, they may not be right for you. So you need to check with your doctor or your physio before even trying them. Okay, so the first exercise we're going to do is an isometric crunch. Now, for a lot of these exercises, your knees are going to be bent in this position. It doesn't have to be exactly this. If it hurts your knee to be in this position, having it slightly straighter can help. You can even prop some cushions under there. It doesn't matter. It's just going to be bent up a little bit because that helps your back. So up. We're going to be in this position. I'm going to have my legs there because that's comfortable for me. And if we first look at the action without me talking you through it too much, this is what it would look like. So coming up, holding it, and putting it back down. Now, what am I doing? I'm tightening my tummy, and to make sure that you know you're controlling your lower back properly, I want you to just roll your pelvis back so your lower back is flat in the floor. And I want you to feel that all the time, that it's actually pressing into the floor. That way you know you're activating your tummy. Then we're going to curl our spine one bit at a time. So we're first going to lift the head, then the neck, and then the upper back. And when we come down, we're going to reverse that movement so that you put your upper back down first, then your neck, and then your head. So I'm supporting my neck because I have always got a neck that struggles a bit. You can have your hands in other places if you prefer. So I'm tightening up my tummy muscles back into the mat, lifting my head, my eyes to look at my knees, lifting my neck, and then my upper back. Now in this position, you're going to hold it for a bit. Start with short holds, so 5 to 10 seconds. And then you unroll it again, keeping your back flat, putting your upper back down first, then your neck, and then you rest. So we're coming this way, hold it, and unwinding. If you hold it for 10 seconds, you've got to rest for at least 10 seconds afterwards. If you hold it for longer, you've got to rest for longer. So one of the ways you can make it harder is you start with short holds and you build up how long you hold it for. About 30 to 60 seconds is quite a good time. And then you can add arm movements. So for instance, if we roll up again, we're in this position, you're finding it good, you're checking your back, everything's good. You can do things with your arms, you can put weights in your arms, do that type of movement. All of that will make it harder. You can pull a band, and then afterwards you just unroll again. So there's plenty of ways to make it harder, but make sure you nail the simple one first and you've got good control, and especially your neck is happy with that. The second core exercise is a isometric curl down. Now, sometimes people whose necks aren't very happy with the crunch does better with this one. But it's a little bit harder on the lower back, so you may not like it if you've got back issues. So we start with about this leg position, and you can hook your feet under a bed. Just make sure that you're not then just hinging from the hip flexors. We want actually to engage the stomach muscles. Okay, so watch out for that. But obviously if your knees hurt when you pull with them, that's not a good idea, so you're going to have to adapt it as well. If you can't hook your legs in and you find as soon as you come back, your legs want to lift there, it's because you are not controlling it properly with your tummy, and you need to just practice it more shallow and think about concentrating really on what you feel in your body and how the balances are there. So just work on that a little bit. But here's how we're going to do it. So you sit in a nice upright position, feet are comfortable, knees are slightly bent, And you start by tightening up your tummy muscles and just curling your lower spine down. And we're going to start with just holding it in this position. So you can see I'm not really hinging back from the hips like that. That's an exercise as well, but it's not this one. You want to try and curl this bit down to the floor a little bit and hold it there for me. So what I can feel in this position is I can feel my tummy muscles engage. I can feel my hips engage a little bit, but my neck is actually quite comfortable. You can see I'm not straining to keep me there with my neck. I'm really controlling it all there. Now, same as before, you start with short holds and you start with shallow, and you can build the time up then. Once you get to about 3 sets of 30 seconds or 4 or 3 sets of about a minute, I would make it more difficult. And one of the ways you can make it more difficult is you just go lower down and hold it there, or you have it there, but you do it with a weight, or again, you do arm movements, or you put weights in your arms and you do movements there. But I would first nail that simple one. I didn't show you how to come up properly. So we're curling down. When you reverse the movement, again, you just lift from here and you bring your chest up and you come up like that. The next one is the Russian twist. Now, same thing here. If you need to hook your legs under something, that's okay. But I would always try to work that you get that control, that you don't actually get the legs lifting up, that you can start doing it without having to hook them in. Adjust your knee position so that it's comfortable. You can do it with slightly straighter legs, but it's easier if your legs are a little bit more bent. So what we're doing is, again, we're curling down a little bit. Now, instead of holding it here and just holding it, we're going to start twisting from side to side. So we're doing this motion, and I like to have my hands in front of my chest so that when I twist, I'm thinking about keeping my hands in the middle, and I'm not trying to go as far as I can. I'm twisting from my torso and going to where my natural restriction is, and then I'm holding it there. And then I come back and I do it to the opposite side. So it's not a massive movement, especially if you've never done it before. It can be quite a small movement to get used to that kind of feeling. And then the thing you want to watch out for is that you've got good control, that you're not ending up arching your back while you're doing it. You want to keep those tummy muscles in and just keep that slight rounding there. Okay. Then I would start without any weight and just build up to where you can do about 3 sets of 10 to 12 repetitions with about a minute's rest between. If that's too easy, it's as simple as holding a weight and doing that motion. Now, you can either hold it there or you can put it there, but I find when people jump into this one where you place it down on the floor too quickly, they lose form. So first, just practice how it feels to control it nicely when you go side to side, and then practice putting it down. And the slower you go, the harder the exercise, because the less momentum you can use. So that's a brilliant core exercise for the oblique muscles especially. A really nice exercise for the obliques, and especially if you've got knee pain, is when you do lumbar rotations with a ball. Now, the reason it's good for knee pain is you can rest your legs on the ball and reduces all the strain on the knees. When you do get a ball, make sure that you get one that's at least as high as your femur is long, or your upper leg is long, because then your leg rests in a much better position. You can see mine's a little bit small, but it's because I have lost my pump and I had to inflate it manually today, and it was hard work trying to inflate this without a pump. So I'm just going to adjust the exercise a little bit to make it more comfortable for me. So this is how we do it. You're going to have your legs on the ball. Now you can see if I have my legs there, they're too straight, they're not really in a good position. If I had a bigger ball, I could bring it that it was nice and in this position. That's where we want it. So I'm just going to adjust it and bring my heels in and have it there, because we're just using it to rest it. Now, again, you can adjust your legs slightly straighter if you want. The idea is that they're comfortable for you, your knees. You want to put your arms out to the sides. I'm a bit limited because my wall's stopping me here, so I'm just going to have one arm. And all we do is we tighten up our tummy muscles and we're slowly rotating it to one side to where you feel you can control the movement. My lower back is coming off the floor, but I'm not falling or losing my balance over to that side. I can control it. And then back to the middle. And same thing for that side. So we're going to that side and control it back to the middle. Now, I'm not steering the movement mainly from my legs. I'm using my stomach muscles to initiate it. So I'm turning from my stomach over to the side and coming back up. And then over to the side and coming back up. And I would do about 10 to 12 repetitions, rest about a minute between them, repeat that. The stronger you get, the further down you can get with the movement and the better you control it. But always make sure that you have good control while you do that it's not just falling over and there's no control involved there. Next up, we've got a glute exercise mainly, but it does work your back muscles as well, so it helps to strengthen the back of your core. I prefer to do it with a cushion under my stomach because then I know my back's not going to go into a position that it's going to hurt, but you can do it without as well. So what we're going to do is you place the cushion so it's under your stomach. Just make sure I'm in the video. Yes. Go a bit forwards. Okay, so that's where you want it. You're going to have your arms down on your, or just rest your head on your hands. And you're going to bend one leg. I'm tightening up my tummy muscles so that I don't get a twist before I start. So tighten all of that. And I'm just going to look at you while I do it, but I want you to look down when you do it. And you're just lifting it up. Now that's my range. If I had to lift it higher, I would have to twist. So I'm just going to lift it to there and come back down. What you want to think about is there are two key elements for me here. The first is that you really think about tightening up your tummy because you want to keep your back kind of straight while you're doing it. So that's step one, and your stomach stays tight all the time through. Then the second thing is when you lift it, don't lift it from your back. Lift it by tightening up your bum. So you're lifting it like that, okay? And then slowly back down. So that's the movement we're doing. And when you're up there, think about, where am I feeling this? Am I trying to lift with my back? Can I feel my bum squeezing? And then come back down. Now, you can repeat that about 10 to 12 times, depending on how fit you are. You can even start with fewer repetitions per side. So 5 repetitions, rest, do the other side, do about 3 sets on each. You want to rest about a minute per leg. So if you rest a half a minute here, then do this one and a half a minute, you get a minute in total. That's how I cut the time down. And one of the ways that you can make it harder is by just lifting a straight leg instead. One of my favorite ones for getting the glutes if your knees aren't happy with life is doing side leg lifts, because you can really feel it working there and you can make it quite hard. It's also a nice one because you've got to control your core while you're doing it, so you're getting the benefit of having to control this while moving a leg. So there's lots of benefits from this. The first thing is that you're going to lie on your side. Now, you can have a cushion under your head if your arm's not comfortable doing that, and you can have this arm wherever you want it. I'm just going to do that for the sake of today's video. This leg is meant to help you stabilize. So I've got it bent into this position. You can have it slightly differently if you want. If you're going to have it totally straight, that's a bit hard. So I would prefer to have it slightly forwards and bent in that position. And you're absolutely on your side. Now, what really helps this exercise is if you start by flexing your foot, because immediately you engage your muscles around your leg and it makes it easier to lift it up. Okay, so if you're struggling with getting it right, just flex your foot. I'm going to do it with a flexed foot today. So at the moment, I've actually got my hips rolled back. So I need to correct it, and I've got to bring it slightly forward so that my side of my hip really moves or shows directly up to the ceiling. And in this position, I'm going to lift my leg just to there for now. Now, check what's happened. Has your leg drifted forward? If you can see your whole foot and all your toes, your legs drifted forwards. And what we actually want is that you bring your leg back so that you can feel, if you do that movement, you can feel your bum engaging more. And I can just see the tips of my toes, and that's where we want to do it. So you've got to feel your bum engaging, and you shouldn't be seeing your whole foot, and especially not your lower leg. Then you know it's really too far forwards. You either just want to see your toes or not see your toes much, depending on how big the bump is up here. If you've got any bumps going, babies or anything like that, you're not going to be seeing your foot. Now, that's the position. And the second thing is, if you can't drop your foot all the way down without doing a funny movement, you don't drop it all the way down. And let's see, this is my range. If I try to lift it higher, I'm going to have to twist, and we don't want that. We just want to stay in range. So I'm going to do it in this position, and we're just going to go slowly up and slowly down. That's what we're doing, and this is the speed I'm going at, because at this speed, I can really control it all, making sure my tummy stays nice and tucked. I'm not rolling back with my hips as I lift up. Everything's staying in alignment. If I went faster, then I would start adding momentum to it. I won't work my muscles as hard, and it's very easy to lose your form then. So that's the easy version of the side leg lift, and you want to be feeling it in your glutes. If it actually hurts, it may mean that you're trying to lift too high. If you feel it in your quads, you've allowed your leg to drift forward, because then you're using your quads to do it. Bring your leg back and tighten your bum, and that's where you want to do it. If you want to make it harder, you can just tie a band around your legs. But then if you're doing it with a band, you're going to have to have straight legs, so you better have good control then with your core already. This time I can't have one leg forwards because that won't work. They're both straight. Really make sure that my legs are stacked and I'm in this position. And that's where we go. Okay. Now, of course, if it hurts your knee, even without the band, and by the way, if you've got painful knees, you'll notice I put the band above my knees. I don't put it on the knees. So if your knee hurt in this position, you could also do it with straight legs like that. Working 10 to 15 repetitions, doing 2 to 3 sets each side, so you switch sides each time. But if you switch sides too quickly and don't rest a bit in between, you'll find that your glutes really fatigue after a while. So I tend to do a set, rest 30 seconds, do the other side 30 seconds, do the other side, because it roughly takes about 30 seconds to do one set as well. So each side gets about a minute's rest in total then. Another nice exercise that isolates the glutes is the clam exercise. Now people tend to say that, oh, it's for piriformis or it is for the glute med. But actually, when they've done studies to see what muscles are used with the clam, it's everything, including your glute max. And you can make it really hard. So if you can't do any other types of glute exercise because of your knees, the clam is a good option. Again, you can place a cushion or a pillow under your head. You don't have to have your hand there. You can have your hand wherever. Same thing as with the side leg lift. When we lift the leg at the top, we don't want to roll back with the hips. So your hips have to be stacked, and most often, I find people actually roll back to start with. So bring your hips forwards so that they're really pointing up. You want to be kind of in this mid position, but if that hurts your knees, straighten them out a little bit, do different things, see what's most comfortable for you. The action is that you tighten up your tummy, because we've got to keep this still, and you just concentrate on lifting this part of your knee back into that position. So this is what it looks like there. Now, like I said, if that amount of bend, your knee doesn't like it, you could have them straighter and you could do this movement instead. Okay. But the same thing applies, that you've got to keep your tummy muscles tight while you're doing it. And to be honest, this actually feels more challenging to me than if I do this one, because depending on where the legs are, you work slightly different muscles. Okay. Now, the key here is that you bring it down slowly as you bring it down, so you really get that benefit of the eccentric control as well. Okay. And one of the main reasons why people can get that the clam actually causes pain in the glute is they try to lift it too high and then they squash things. So don't force it. If that's your range of motion, that's your range of motion. You just lift to where you can control it and it feels relatively okay, and you bring it down. Because the other thing that happens is if you try to force it, you just roll back. So keep it in the limit that's comfortable for you. You can just place a band around the top of the legs. If it's too easy. So this band may be too loose, but I think it will work for demonstration purposes. Here we go. So you'll be doing the same thing there. Now, you can see my band doesn't actually tighten that bit, so I'm not getting the full benefit. So when you tighten your band, you want it to be tight from there already, that you pull against it all the way from there. They come in different grades, and you can get on Amazon, they sell packs of 5 different grades, which is brilliant, because then you can start with the lightest, really get your technique well with that, build your endurance, and then once that's easy, you switch to the one up. So I'll put a link in the comments or in the description of this video if you want to see what I mean by that. If you can do 3 sets of 15 repetitions of a specific type of clam, I would move on to the next type or make it harder. If you're struggling with the clam position and there's something about that your body just doesn't like, I have made a full video about clams and alternatives to clams if you can't do them. I'll put a link to that one in the description of this video as well. The one I left for last is the bridge exercise, and specifically the glute bridge that you do on the floor. Now, the name pretty much tells you which area that's going to work. It works your glutes, but it also works your back muscles and your core muscles. So it's a brilliant all-in-one exercise. The only thing with the bridge is that it can irritate your knees sometimes, depending on which part of the knee is irritated. So I'll show you some adaptations that may help for that. But if it doesn't work, then you just have to choose a different type of exercise for your glutes. So here's what it looks like. The closer you are with your heels to your bum, the less your hamstrings work and the easier the exercise. But if you have knee pain, especially towards the back of your knee, you'll know that this position can be quite uncomfortable. So you may not want your legs there. So you may want them slightly out further. Or if it's just one leg that's more painful, you could have one leg slightly straighter. Okay. Sometimes also you can, if you come onto your heels, that can put that can work different muscles harder, and that can take the strain of your knees. So play with those and see what you find is best. So I'm going to have my feet flat for this. We start by tightening up your tummy muscles, and then we're going to think about squeezing your bum to lift you up. Because if you think of just lifting up, sometimes what people do is they just go with their backs and they do that. Okay, now in this, I used my back muscles to get me up there. I used very little of my glutes, and we want to work the glutes in this exercise. So you start by tightening your tummy, squeezing your bum, and then thinking about squeezing your bum all the way as you go up there. And that's where I stop, because that's where my hips stop me. Can you see the difference in quality of movement if I do that, where my back took me up, versus I squeeze my tummy, squeeze my bum, use my bum to squeeze me up and hold the position. And now that I'm there, I'm feeling my bum squeezing, I'm feeling my hamstrings working a little bit, a teeny bit of pressure in my lower back, but not much, whereas previously I was feeling it all in my lower back. Now, you can do this in 2 ways. You can either hold this position, count for 10 seconds, then come back down, rest for at least 10 seconds, go back up, build that up, that you get to 3 sets of 30 seconds I would do before I then increase it. I wouldn't go for 60 seconds. That's kind of a waste of time. I would add weights and things before that. But sometimes holding the position there can irritate knee pain, because especially the kneecap doesn't like that contraction the whole time that's just sustained. If that hurts you, I would just go, what happens if I just do repetitions instead of staying there? Sometimes that's better for the knees. So check, you've got those 2 options. If you're doing the repetitions, you want to do build up to 3 sets of about 15. You can make it harder by placing a weight over the spit and just lifting it like that. But I've also made a video just about the glute bridge, where I've talked about how you can transition and build your strength so that you eventually can go on to single leg ones, still using good form. Because what I find with people is that they find the double leg one too easy, and then they rush to single leg, but then they don't actually have enough strength to bridge that gap, and they end up just really having really bad form. So if you want to increase your resistance with your bridge, have a look at that video. I'll put a link to that one in the description of this one as well. Excellent. I hope that's given you some ideas. Now remember, if you need more help with any type of sports injury, you're welcome to consult the team via video call. The link to the website is in the description of this video. Take care.